this webinar to give an opportunity to talk before all the delegates. If you don't hear, just let me know, because I'm not sure whether you can hear me or not properly.
I can hear you, sir. We can hear you.
Okay. Yeah, so I'm here to give you a small basic understanding of how the pharmacy system works here. It's more or less like a discussion session. Particularly in the pharmacy system, in a community pharmacy, it's one of the largest sector in Australia compared to all other sector. And yeah, I'm going to give a brief outline about the career opportunities at present for overseas graduates, and also the registration pathway, and a little bit of info about the visa. And I can't give you the right advice because I'm not a migration agent, so I can give you a little bit of basic understanding how the visa system works at the moment. It's more or less focused on how the system here works, plus some info about career opportunities and the visa system. So when I say how the pharmacy system works, I have to start with the basic, starting from the basic and go accordingly with some few information. Then we go to the career opportunities for overseas pharmacists. Then we'll go again to the possible visa options. Yep. So we'll now screen share. All right, so I hope you can hear me now.
Yes, sir.
Yes, sir.
So yeah, so as I said, it's a broad view on Australian pharmacy profession and a varied role of pharmacist here, and what are the career opportunities and the pathway, some bits and pieces of information about study opportunities. This is the basic thing that we are going to discuss now. So the aim of the webinar is to project how the pharmacy system operates by some lecture, images, and possibly some videos. Going to tell you about the regulatory board that controls the pharmacy profession. There are a few boards like APRA. Most of them by now already know about these things, but this is for those who don't know anything about this regulation. APRA, this Australian Health Practitioner Regulation. APC will be the one who all overseas pharmacists deal with at the moment. Australian Pharmacy Council, PBA, Pharmacy Board of Australia. TGA is the one who controls the medicine regulation, and the state authority. There are different like respective authorities for each state. It's total 8 of them. Next we'll have a small discussion over the government involvement, like the regulation and the rebates for the pharmacy. So how the pharmacy system is controlled by the government and the rebates available. Then we'll go to the different roles played by the pharmacist here, and various service offered from the community pharmacy especially. Then we'll have a discussion on overseas pharmacist pathway, application, exam, registration, those kind of details, and the career opportunities for overseas pharmacists. So we get a job or basic visa information and the study options. And lastly, we can discuss how we can implement this, the one we discussed, can be implemented elsewhere, like in overseas or somewhere, to uplift our profession and attain the same confidence as we got it here in Australia, in other countries as well. All right, so you can contact me if you have any doubts at dip131@yahoo.com. So in case if you want to know more or something, if you want to know extra. So this is myself, and I did that working as a community pharmacist in Australia for 12 years. I had a few experience in teaching AMGs in an institute in Melbourne before. Now I'm involved in an Australian institute with devising an online course to teach this step, what we discussed, to everyone overseas in an online way. And we also discussed with the other owners to create something like an online database for internship for overseas pharmacists who are looking job opportunities for internship in Australia. So these are the just basic pipeline. Still, the discussion is going on. So the course is expected like it's like a what do you call? It's a career growth and gain expertise in pharmacy practice in your own country and also in other countries. So it's like a knowing the Australian system and how you can implement something in your own country. Yeah, so we'll go to the basics of the medication. So classic, basically there are 4 schedules. All the medicines are classified into 4 schedules. Like in India, for example, we classify as Schedule H and something like that. Here it's mainly in pharmacy, there are 4 schedules, 2, 3, 4, and 8. And there is other schedules like Schedule 11 and unscheduled. So Schedule 11 comes under Schedule 4. So don't worry about this. So it's 2, 3, 4, 5. So sorry, 2, 3, 4, 8. And when you say Schedule 2, that's called pharmacy medicine. In the top of the box, it's written as pharmacy medicine. That means you don't need a prescription to buy this. You can just go out, go into the pharmacy and get this medicine by yourself. You don't have to ask anyone. But still, people like to ask to the pharmacist how it works and what to choose, etc. That we'll discuss later on. Like cough medicine or Senelex or constipation or whatever, that comes under Schedule 2. When I say unscheduled here, the Panadol comes under unscheduled. For example, can be sold in supermarket, but if it is only less than quantity 24, they can't sell more than that. It's like an example. So basically all the pharmacy medicines can be sold only in a pharmacy. No supermarket or any other shop can sell this at any time. And so when I say Schedule 2, that means it's still regulated by the government, even though it's available over the counter, still regulated by the government. When you come to Schedule 3 here, that's pharmacist only medicine. So these medicine not kept outside, it's kept inside the counter. So if someone comes to the pharmacist and asks, I got a headache or I can't breathe, so etc. So the pharmacist will ask few questions and we'll have a discussion with them, and we'll have a discussion with them, and then they will recommend something suitable according to the patient's needs. So a few examples are salbutamol inhaler and low dose corticosteroid cream. Then we come to Schedule 4 medicines. Schedule 4, that's prescription only from a doctor's script. That's straightforward. And Schedule 8, still it's a prescription only medicine, but it's controlled like morphine, like those kind of medicines. There is a subclassification of Schedule 4, which is Schedule 11. That's like diazepam, all these benzodiazepines. That comes under Schedule 11. So basically, this is the 3-4 different types of classification where the drugs are classified and regulated. So the TGA is the one who administers all these medicines. It's responsible for the regulation, anything like prescription medicines, vaccines, sunscreen, vitamins, even the medical devices. So if somebody wants to say, I want to export medicine to Australia, there's so many questions asked. You can do that, but you need to have a TGA approval. Like you need to have an approval from TGA and get the medicines or products listed under ARTG, that is Australian Register of Therapeutic Goods. if you want to export, say, from India or any other country, say atenolol or whatever drug, you need to first contact TGA, submit an application to the TGA, and pay all the fees, etc., etc. They will do all these checkings. Even few medications are coming from India, even here from like Cipla, Ranbaxy, Reddy's. Still, we have few medications coming from India. So it's not a new pathway; it's an old thing. If not listed in the ARTG, the therapeutic register, it becomes unapproved goods and cannot be used in Australia. It cannot be used. There are few exceptions, not few. It's only two exceptions. That means you can get an unapproved medicine for experiment. If you want to do some experiment, or for personal use, not for selling, for personal use. But still, there are a lot of application process. You can't get a it's straightforward. Someone can send the application by post. It's not like that. So what I'm saying is the TGA is the main administration department who controls the medicine, so that the public health is protected. That's what they want to overview. So as I said, it's two-tiered system. TGA classified as registered and listed. There are only two types of registration. Some medicines are registered. All the OTCs, most OTCs, all prescription medicines must be registered. And when I say listed, that means it's listed in TGA, but the efficacy not studied. It doesn't mean that they don't work well, but there is no way to study the efficacy. For example, some complementary medicine. When I say complementary, it is called natural products. And for OTC, this short form, over the counter. So some of the complementary natural products cannot be studied for efficacy. Those comes under the listed. So these are the basics of TGA. When we come to the regulatory bodies, the main one is APRA, Australian Health Practice Regulation Agency. Controls all the registration standard for all health professionals, not only pharmacists, for doctors, dentists, whoever it is, and device standards for overseas practitioners, handles the compliance, training, etc. Then this is the APC, Australian Pharmacy Council. It's an independent body which works as a non-profit body. It's a national accreditation authority for pharmacy education and training. It's not only for overseas pharmacists, it's also for local graduates, for devising a training method or an internship program, etc. So they overlook this section. And they are the one who involved in international skill assessment and oversee thousands of pharmacy examination. So APC is the main or the first contact for any overseas pharmacist. So then individual states have their own authorities, like there are different like Victorian Pharmacy Authority or New South Wales, Queensland. They have their own authorities who will overlook the functioning of pharmacies and pharmacy department in hospitals, like whether they are carrying out the department or pharmacy by rules, or you have to they will do the inspection and conduct all the audit checks, etc. Those comes under this individual state authority. And PBA, like Pharmacy Board of Australia. So it comes under APRA. So the main role is oversee the registration standards, guidelines, and code of conduct for pharmacists. So the PBA and APRA is kind of the same. PBA comes under APRA and oversee the registration standards. So why the pharmacists, why they are very concerned about getting registration? So no one can work without any registration. So the main aim is to protect the public by ensuring that only suitably qualified and trained pharmacists are involved in the dispensing or practice. It's a heavy fines are introduced if somebody is not as a pharmacist, And if even though they study pharmacy and not a registered pharmacist, then they can't use the title pharmacist or pharmaceutical chemist. Even the graduates cannot practice until they hold provisional registration. This is the first registration where overseas pharmacists should get it. And once they complete the supervised pharmacy arrangements, then they get full registration. Until then, they will be under provisional registration. With the provisional registration, they can work under someone like a supervised practice. Then after working for 1 year as an intern, then they can apply for general registration. So when I say this, there's a lot of pathways to become a general registered pharmacist, because there are certain things which can go wrong. Like someone will make complaint about any pharmacist, like they're not doing the job properly, or they did some mistake, or they can just ring or be filling up the form or just in writing to the board, and the board will look after these complaints. So to avoid these things, the board has devised certain guidelines and registration standards so that the pharmacists practice and follow those guidelines to avoid these things happen, and also protect the public. Most common reasons are dispensing error, like somebody dispensed different dose instead of certain dose, or communication error issues, boundary issues, and behavioral documentation. A lot of things. So that's why these uh, kind regulatory bodies are very strict in getting this pharmacist registered from professional to general registration. Yeah, this is the general qualities of a pharmacist. So one should have a high attention to detail. Should have a good like verbal communication skills. That's most important. So here, once you became a pharmacist, registered pharmacist, they don't expect you became. They don't really expect you became a like what you call a very highly intelligent person. Should have only the uh, good knowledge with a strong verbal and communication skills. That's most important in any pharmacy sector. And also problem solving skills, multitask activities to decide which is good or which is not. Um, uh, Sometimes you have to make your own decision, like whether to do this or not. If you do a wrong thing, it comes to you. It doesn't come to the owner, or it doesn't come to the those who own the pharmacy or higher authority. It comes to you. So those things has to be decided. That's why there is few qualities they should have. After certain years, you should ability to work independent, and most importantly, should build a rapport with other healthcare professionals. So in general words, this would be very outgoing personality. Yes, so this is the different roles played by the pharmacists in Australia. Like compounding pharmacy is the one who make um, to make like creams or tablets or sterile products, capsules on prescription. So sometimes there are medications which is not available. So what happens is the doctors write a prescription, and the compounding pharmacist will make it accordingly. And it depends for general practice. It's a new system. Like the pharmacist can work in a medical center pharmacy, so and advise accordingly. And hospital industry communities, the old traditional pathways, and now there are diabetic educators. After getting pharmacy registration, some pharmacists do some diabetic course and became a diabetic educator, and also medication management review. It's like it's kind of a review of all the medications what the patient is taking. Like the patient may take 10 or 15 medications, so they just prepare a list, and sometimes the pharmacists go to the house, sit with them, and study what all the drugs the patients are taking, and prepare a report and submit to the doctor for changes. It's another interesting career. The pharmacist has to do some extra course once they get registered and became an MMR pharmacist. Yeah, then yes, there is industry. Um, Industries also, there are scope in the industries. So basically, you don't need to be a pharmacist to work in the industry. Um, what the local students do, they study Bachelor of Pharmaceutical Science to work in the research field or biotechnology or in the industry field, but they cannot work as a pharmacist. Once they study this bachelor, they go for a Master of Pharmacy course. If they want to become a pharmacist, then they go accordingly to the pharmacist pathway. And still, industrial pharmacists are listed and under the migration program. Um, they can apply visa 190, sponsored visa 491, 494, with TSS through the Skill Assessment Authority. This is just a general info, but this has to be explored more, and somebody interested has to go through deep by looking under these visa um, more and get the more details. And every time this changes, it doesn't stay the same. After 2 months, when you see the one visa will be not there and the other visa is added, it just changes all the time. And it normally get updated in the immigration department website. There are few clinical trial jobs, but migrating as a clinical trial pharmacist will be a hard. I'm not sure whether it can be possible, but I'm not sure whether somebody has already migrated with the clinical trial job. But once you get, or somebody has got a permanent residency here, or somebody has got a permanent visa, still they can try other job sectors like clinical trial pharmacist. Um, Basically, they want with residency. They don't sponsor. Um, so someone in overseas has got GMP or GCP experience or clinical trial experience is highly desirable, and they can, if they get a visa permanently, they can continue as a clinical trial coordinator or something like that. But it's not highly famous in terms of migration. Yeah, same, the clinical research associate. So if you have a good working knowledge of ICH and GCP guidelines and international regulatory requirements, it's very good because you can convert your pathway in the future once you get the visa to clinical research associate if you're interested. Yes, so it's this one is the basic, again, basics of Australian system. Subsidized medicine by the government. So you can see the word PBS everywhere when you come to Australia. It's PBS is a pharmaceutical benefit scheme. That it's a program by the Australian government that provides subsidized medicine to the residents of Australia. So when they go to the pharmacy to buy medicine, they pay certain amount, and the remaining part will be paid by the government. That's how the pharmacy system works in general. So to provide you with an example, say for example the cost price is $500 and the particular medicine is listed under PBS, then the patient pay say $41 maximum, and the remaining cost paid by the government to the pharmacy. So the remaining cost, when I say this changes every year, so the government will work out how much to pay, how much to be paid to the pharmacy for particular medicine. It changes all the time. And it's not 100% medicines are listed under like this. Some medicines are not listed under PBS. Then the patients have to pay $500 in this case. So mostly the important medicines or the life-saving medicines are listed under PBS, so that all the patients can get comfortable access to the medicine and do not compromise their health. So in community pharmacy, that's a major part among all the pharmacy sector. It's about 5,000 to 6,000, I think, pharmacies are there in Australia. Um, so most people's first contact is the community pharmacist. If they have a problem, they come straight to the pharmacy and say, oh, I got this problem, what should I do? The pharmacist will look at and have a discussion with the patient, and if they need, they will give, if it is a need, the pharmacist will provide some remedy or not, the pharmacist will divert the patient to the doctor. So that's why the community pharmacy is a major part, and more funding is shifted to this sector. So basically, this is the setup of a pharmacy where you can see how the prescriptions, that's the section, and the medicine section is separate. This is what I say S2, where you can see cold and flu, cough, or allergy. The patients can come and get this medicine without anybody's help. And S3s are kept this side here or sometimes inside, where you need the pharmacist to come out and talk to you, then advise this medicine to you. S4s here. It's and S8, it's locked inside the cabinet. So, so the medication management reviews. When I say, I think I have explained to you about this, like the pharmacist go to the patient house and discuss one-to-one interview with the patient to discuss how the medicines work, any dosage, side effect, or something, any concern the patients have. There are rebates from the government to do this, and so since it's the comfort, since the service is provided in their comfort of home, most of them are willing to accept this and make a relationship with the pharmacist. So these are the general positions available in Australia. Like you can become a pharmacy owner in Australia. So you can buy a pharmacy or start a pharmacy, whatever you think. And once you have some experience, like few years of experience, most people will go this pathway and they can buy the pharmacy. And you need to have that. Yeah, you need to have that certain kind of skills to shift from the pharmacist to pharmacy owner. You have to manage the system properly. So you need to have the financial understanding of the financial strength, workforce training, overall management. So it's very highly much scope. And remember, only a pharmacist can own a pharmacy in Australia. No doctor can own a pharmacy in Australia, but a pharmacist can own a medical center, but not vice versa. So it's very restricted and highly rewarded career. And any profit from the pharmacy should go to the pharmacist owner. No one can take the profit. So this is because the government doesn't want someone from outside to start a pharmacy and run the pharmacy to make a profit. So there is a new system here, e-script. Currently, it is just rolled out now. So the paper script will be slowly moved into e-script. That means the doctor will send digitally to the patient mobile the script or to the pharmacy, and the pharmacist can dispense with a QR code. And once the pharmacist dispense, they can generate a new the repeats. Here in Australia, for example, the doctor write a medication with repeats, like 2 repeats or 3 repeats. So if there is no repeats, then the prescription is held in the pharmacy. They can't give it out. So only if the doctor write a repeat, the next copy will be given to the patient, and they can again come back to get one more time. If there is no repeats, then the patient has to see a doctor again to get the prescription and come back. So in this case, if there is a repeat, a new QR code is created and the e-script is generated. These are the new things that's coming up. And as I said, there is a lot of patient professional service carried out in this pharmacy.
Excuse me for a second. I see that some of the audience is drawing in the platform. Please don't do all this type of activities. Please remove it. If someone has drawn it, please remove it. Okay, there is some drawings being made there. So please remove the drawings. Okay, continue, Deepu. You can continue.
All right. So yeah, there are patient professional surveys carried out in Australia. For example, vaccination. It's one of the rewarding option or career for the pharmacist to inject flu vaccines or hepatitis vaccine from a certain age. That's a new professional service, and the other ones are blood pressure, glucose check, cholesterol check, etc. So um, it's not a the pharmacy is not like just come and get the script and go. It's more towards the professional thing. Like people come there to have a blood pressure checked or their glucose check or to know how much is the cholesterol. If they want to have say for example want to take leave, the pharmacist can provide leave certificate for 1 or 2 days, and they can do health check. There's a lot of professional service carried out in a pharmacy. See, for example, this is the blood pressure check. The pharmacist checks blood pressure, and if say for example, if it is like 150 or 160, then the pharmacist will recommend the patient to see the doctor. If it is too high, immediately, or if it is near to moderate, then he will ask him to come back and make a again further test. So these are the blood pressure, services that can be provided in the pharmacy to create value for the pharmacist and trust in the community. As I said, this is the immunization. So the pharmacists can give immunization now, so they can inject vaccines. It's an extended role, and slowly it started with the flu vaccines, and slowly it will be extended to other vaccines slowly. This is the compounding. When I say compounding, so the pharmacist can prepare a capsule on a doctor's prescription if the particular medicine is not available commercially. So there are few medications that are not available commercially. In that case, the pharmacist write a medication, and the patient go to the compounding pharmacies. Not every pharmacy is a compounding pharmacy. Once they go to the compounding pharmacy, the pharmacist prepare the capsules accordingly. This is the compounding pharmacy. There are a few other services like anemia screening. People with anemia or pregnant or breastfeeding, they can come to the pharmacy and check what's their HB level. Once they check the HB level, the pharmacist can recommend them to see the doctor or to monitor further, etc. And also it's a COPD screening. The pharmacist doing this here, the COPD screening. Once, it's in the consulting room. So the device will detect the disease progression. So when the pharmacist found that the patient has to be referred, he then refer patients to the doctor for further assessment. So you can see the customer blowing into this spirometry device, and it's connected to the iPad, and the results are recorded. And yeah, there are a lot of weight loss programs which are in conjunction with CSIRO. It's not like any product can be claimed as weight reduction. It has to be proved and tested, and there will be a lot of weight loss programs available in a pharmacy where they test BMI, blood pressure, glucose. Then a action plan is formulated, and a weight loss products are recommended. Improm is one of them. Then diabetic check. It's like same thing like blood pressure, where the pharmacist can check diabetic readings and can advise accordingly. Same thing, if it is too high, then it has to be done again or referred to the doctor. This is done in privacy, and it's not done in open, and there should be consulting room in every pharmacy. So they can provide vaccination, and there's no prescription required. The people can come straight to the pharmacy and get vaccinated at present for 3, like flu, MMR, and whooping cough. And there are services for sleep apnea with the mask, and machines are provided to continuously monitor the air pressure. And again, the same sort of services is there is a sleep apnea management. And once they tested, it's again referred back to the doctor. So diabetic education is a very vastly growing field because diabetes is increasing gradually. And so pharmacist diabetic educator role is considered very important because they can educate and support patients living with diabetes. So one has to get a credentials. Like once you became a registered pharmacist, the pharmacist will do extra course to become a diabetic educator. It's like a specialization where you can get more um, skills and knowledge so that they know what's happening at the current scenario and advise accordingly. Medication review in aged care is getting popular because aged care is growing massively. So it's about roughly it's about 200,000 at present living in the aged care with 3,000 facilities. And there are a few rebates for the pharmacies to do some services in this sector. And the pharmacists again provide dose administration aid. It's like a specialized dose administration aid where the medications are packed and sent to the aged care so that it can be taken without any error. So typically, this is the pharmacy where the patients come to you and can do counseling. They will be asking few questions, and the pharmacist can be in the floor so that I can advise a lot accordingly and devise a special or specialized um, remedy for that particular patient. So there are a few extended trials are going on, and now the trial programs like pharmacist prescribing. Um, it's the first time it's been conducted in Queensland to dispense trimethoprim nitrofurantoin and cephalexin without a script. The trial is going on. So in the future, it could be extended to more drugs, like the pharmacist can diagnose, prescribe, and dispense all in one center. And there are mental health trial programs and healthcare homes trial. There are a few trial programs are going on. So mainly the rural pharmacies. So the rural pharmacy is considered important in Australia, not only for here, it's also good to know more about this for the overseas pharmacists because I think the visa conditions and more visa are associated with rural pharmacies. So the rural pharmacies are categorized like here into FARIA. We call it as FARIA. It's a remote access from 1 to category 6. Category 6 is very remote. So accordingly, these rural areas are categorized, and maybe this is one of the driving factors for the immigration department to open visa in the state migration program, like 491, and it has to be updated, and every time it changes. So because once they get enough staff, or if they get enough pharmacists or nurses or doctors, then that particular area will not be there. It's kind of a thing. So the rural pharmacy pharmacist plays an important role in carrying out the function of a pharmacist in a broad way, where there are less access to the doctors. Here, coming to the hospital pharmacists are very much highly regarded, and they overlook the medication use and review the chart, calculate dosage, educate doctors, nurses about the qualities of medication, and they should have a rapport with other healthcare professionals, and they have a good competitive salary packages as well. So the job roles are different from various hospitals depending on the categories. Like there are different types of hospital, different roles of hospital pharmacists. It's like specialized programs. When you say clinical specialty areas, like say for example critical care, drug use, emergency medicine, oncology, nuclear medicine. A lot of areas where once the pharmacists get a job, they get accredited in these certain specialty areas and became a, say, oncology pharmacist. Yeah, coming quickly to the skill assessment process. This is the, I think most of them know by now how the system works for overseas pharmacists. So this is the skill assessment process by the APC, Australian Pharmacy Council. There are 4 pathways. I just listed the 3. This is the CAPS pathway for most of them. The competency stream pathway for those who are in Canada, Ireland, UK, and USA. This is the most common pathway within a CAPS pathway. So once you study what are the procedures, registration, exams, it's just straightforward. I think it's all everything given in the website, and one can easily know more details how this pathway works. I just given some basic info for those who don't know what the assessment is, those who haven't looked anything previously. CAPS pathway is the pathway for the pharmacists from India or Asia or even anywhere other than these countries. So this CAPS pathway, the process for requesting a skill assessment letters, you need to first check your eligibility, whether you are eligible. It takes 8 weeks, and there are fees associated for that, which is $1,260. And once you are deemed eligible, then you have to apply for CAPS. That's a knowledge assessment of pharmaceutical exam, and it's processed once you've passed the exam. Then the results will be out in 4 weeks. You can write the exams all over India, like mostly in South and North India, Chennai, Bangalore, Delhi, and also in overseas, like in Gulf countries. So there are a lot of centers now. I think the registration for the future opens in October, and the exam is on 6th to 8th December. You can check these details. So the next exam is in December. So the step-by-step process, when you look at the step-by-step process, first one is eligibility check. You need some documents like identity check, academic qualification. You have to be registered in your country. You can't apply without registration. You have to be a registered pharmacist in your own country. And work history is not compulsory, but it is needed for visa process. So if you can organize the work history, that's more good, because you don't have to wait until everything completes and make work history later. It's better to make a work history. It is only considered if you work in retail and hospital pharmacy, and not anywhere else. So ITLs or English proficiency skills not required at this stage, because eligibility or CAPS exam doesn't need it, but please check anyway. You can include your CV and work reference if you are showing the work history. So these are the general documents can be updated anytime. So after you apply for the eligibility as first step, via portal, pay the fees, wait for 8 weeks, and the APC will come back to say whether you are eligible or not. If you're eligible, then again, go to the portal, register for the exam, sit the exam at your exam center, and wait for 4 weeks, and you will get the results. The results will come like a skill assessment letter. It is valid for 3 years. So this letter is needed for 2 reasons. One, you need to apply for a provisional registration, because, as I said, you can't work as a pharmacist without some sort of registration. So the first registration is provisional registration, and also you need for the visa process pathway. So the CAPS pathway and the visa process pathway are both different. So by gaining one, it's not like automatically will be gain the other. So you need to concentrate on this pathway and this one as a separate. Once you pass the CAPS exam, then you have to write the ITLs or PT, whatever. This score at the moment it is 7, overall 7. PTE 65, OET score B, but you can check in the websites what's the present scores needed. So once you pass the CATS, then you need this English language, because English language requirement is one of the mandatory requirement for getting provisional registration and also visa process. So CAPS exam structure comes with two separate papers. One is paper 1, paper 2, chemistry, physiology, and ecology. All these details are given elaborately. You can study, you can on your own, or you can refer some book, some materials, whatever you have. And the Sutics and Therapeutics is paper 2. So to pass the exam, you need to have 50% in all subsections, not 50% in paper 1, in all subsections. Say, for example, if you don't know anything about chemistry, but you answered fully physiology and ecology, you still fail, because it clearly says that you need to have 50% pass in all subsections like this and this and this. And again, for 50% in Sutics and Therapeutics. If you fail in paper 1, say, and pass in paper 2, you can appear in paper 1 only and pass it. If you again fail it, then I think you need to appear for both subsequently. So, so after you write this exam, then you pass it, you pass the exam, then afterwards the visa process starts. You can apply for provisional registration, but you should be in Australia to apply for provisional registration. This thing you need to do some research, like how do you come to Australia to get provisional registration. You can come in tourist visa or some other visa and get provisional registration and go back. It's up to you. But once you get provisional registration, it valid is only 1 year. So to be clear, the skill assessment letter validity is 3 years. Once you get this skill assessment, which is 3-year validity, you can wait certain time before it expires to apply for provisional registration. Once you get the provisional registration, then the 3-year validity doesn't matter. Then the 1-year validity again comes into the role. So it can be renewed again for 2 times, but more details can be viewed in the APRA website. Once you get the provisional registration and you don't get, say, for example, you don't get visa or you don't get an internship, then after 1 year, then you can renew it. Again, if the same situation happens, again, you can renew it 2 times. After 2 times, I think you can renew by doing some CPD points. CPD is nothing but the continuous professional education. Like you have to do some online it's like an online education system. All the pharmacists here, myself or anyone, has to do CPD points every year to get registration. It's every year they have to renew the registration. It's one of the conditions that all the pharmacists to get 40 CPD points by attending some seminars to to update your skills, to increase your knowledge, or even online. And that's the CPD. So, but yeah, again, verify this thing with this APRA or APC, whether you can renew the 3rd time with the CPD points if you can't find internship. So you got anyway. So the skill assessment is 3 years validity, and the provisional is 1 year validity, and you can apply with provisional registration any internship. So you had to finish the internship before the validity ends. But say, for example, if you are still on the pathway of internship and the professional registration is going to end, you can extend it by paying a fee. So to apply for professional registration, there are forms like APRO to apply for internship, supervised practice, It's called supervised practice internship. It's this form number, and any intern or even the local once the local graduates who pass out the university pharmacy course, they have to do internship in a community or hospital pharmacy for this many hours. Once they do this many hours, then they sit for the final exam, which is again divided into two parts. One is the written exam, and the other one is oral exam. So to be concise, to be in a few points, I would say first thing is eligibility assessment for CAPS. Then you apply for the exam if you are deemed eligible. Once you pass the exam, apply for professional registration, internship. Then once you get the internship, complete the internship these many hours, which is roughly like 10 months to 1 year. Then after the internship, you sit for written exam, oral exam. Then you get registered. Yeah, so that's the CAPS pathway, and this is the CA competency pathway for those who are from UK, USA, Canada, and Ireland. And the exam centers are only in UK and New Zealand. They follow the same steps like CAPS and appear the CAOP exam instead of CAPS exam. And once they pass, the skill assessment letter is provided, same thing like CAPS. But it's a bit different to the CAPS. It's instead of provisional registration, there is a limited registration year. So the limited registration allows them that they can complete the supervised practice with less hours. They don't have to do 1824 hours, which is very lesser than that, and they fill a different form for this. So some of them, I mean, up to a certain level, it's both the same, but the exam and the supervised practice are both different. Anyway, do your research for this updated info, because this can change, or maybe few things may be added. Yes, study opportunities. So some of them who are able to study in Australia, it's better because they can proceed via the International Student Stream pathway, which is different to the CAPS or CAOP pathway. If you study in Australia, any of the course, you can opt for International Student Stream pathway and apply for the visa. In this case, I just given an example of University of Sydney Master of Pharmacy course, which is 2 years. After BPharm, you can apply as international student. These allow graduates to progress towards registration straight away as a pharmacist after you complete the internship program. There's no caps or nothing. And once you pass the exam and once you secure the internship, they will be practice as a general registered pharmacist. It's a good option if the finance is not an issue. There are few scholarships available for international students. It's like 10 or 15 different forms of scholarship. There are a lot of scholarship. So you have to do your in-depth research, what scholarship are available, whether you're suitable, etc. But generally the fees will be a bit high. So you have to be financially stable to be able to do this. This is a master's, and there is a bachelor's program in not only in Stolstad. There are a lot of universities. I just highlighted this uni just to give in for example. Roughly it will be like $25,000 per year, and it's mutually recognized in Singapore. Once you did this course, it's recognized in Singapore Pharmacy Council as well. So you can do a range of international Once you study in Australian uni, you can go to other uni and do some part course as well, like clinical placement or practical placements in a different location. Again, they can offer a range of scholarship, like 15,000 or up to whatever, it depends. So yeah, there are several other universities can offer the study programs, not only CSU, there are Monash, Tasmania, a lot of universities. Each university can offer master's or bachelor's program. Coming to the visa details, so this is as you see, this is just the general info. I'm not a migration agent to give you any specialized advice in this case, and certainly it's purely dependent on their own individual circumstances. Here I highlighted the retail, industrial, hospital. They come under um, mainly these type of classification. There are a lot of subclass. When you look into the immigration website, there are like hundreds of subclass. So pharmacist comes under mainly skilled nominated 190. A few years back it was under 189, that means general skilled migration, but it's not anymore. It's 190 visa, or here the 491 visa. These two visa are most popular, 190 or 491. And there is a new visa, like it's a training visa, so they can come to Australia to do internship and stay here for 2 years. Once the training visa is over, they have either option to seek bridging visa. Um, yeah, when I say bridging visa, it's not like certain. So someone they have to explore whether they're eligible, or no one can say what bridging visa they can get it. So they have to again satisfy. If you look at the 407 training visa, um, from transfer from this visa to other visa, they have to satisfy certain criteria. These conditions are like highlighted in the website. They can check it. So just as far as this is for the general info, 190 and 491 are the most popular visa. This 491 skilled regional visa or state sponsored. It's called state sponsored visa, which is the which is based on individual state. Say, for example, Victoria. Victoria doesn't have any 190 visa at all. They don't have any 190 visa. They do have, but only if you study PhD in Victoria within the last years, then you can apply 190. But say, for example, if you look Northern Territory or New South Wales, there is 190 visa, and they can seek more details when it will be open, and this visa thing, they open and close at a certain time. So you have to wait. It's like a gate. Once they open, they let few people in, they close. Again, you have to wait. I'll explain in detail those ones. Yeah, training visa. This is 407. This is for 2 years, and you have to find a bridging visa or any other visa once it finishes. If you can't find any visa, you have to go back. So once you finish if you can finish the internship, that's more good with this visa, because the reason is it will enable the employer in rural areas to consider you in more than anyone without internship. So if somebody is approaching the rural pharmacy and asking for a job, if you have a internship already completed by training visa, and since you haven't got any further visa, you went back, that could be one of the major changing. So you can try to get a 190 visa or 491 visa, whatever. If not, one of the option is 407. That's the training visa. Yeah, so coming to the 190, it's a permanent visa. You can stay permanently. How this system works is you have to submit EOI, that's expression of interest. It's like I'm interested through the website portal. So once you express your interest for that particular visa, it may be nominated by the state or territory. So the department will only invite applicant to apply for the visa when you get nominated. So you have to wait, apply and wait. Once you get nominated, then the government department will come and say, oh yeah, you are nominated, then continue application. Then you continue the application to get this visa. But there are certain criteria. You have to get minimum 65 But when I say 65, sometimes the state government will increase the limit. It is only a basic point test. I'll show you in other slides what happened to the previous uh, entries. So, and also the occupation must be listed in the skilled occupation list. So when you are applying, you have to check whether retail or hospital or industrial pharmacist is listed in that skilled occupation list under this visa category. It can change anytime. Say, as I said, in under 189, um, previously it was listed, but not now. So similarly, this can change at any time. So this one is 190, and when you come to 491, that is a state-sponsored visa, um, skilled regional visa, state nominated. So it's different rules for each state, and it changes all the time, as he said. So this example is the pre-COVID details. So um, now it's everything is closed, so everybody has to wait when the openings will happen. Nobody knows. So once all the conditions are improved, then they will open, and you have to find whether 491 is open, and put the expression of interest and wait for the invitation. So it should be in the skilled occupation list. Um, Pretty much pharmacists are will be in 491. So for at least for time being. So it's a state nominated, and if you get 491 visa, you have to live there for at least 3 years. You can't move to other state. But with 190 you can. But with this one, state migration, you can't. But anyway, it's good because it's a permanent visa. And but once you express your interest, the government will wait. You have to wait, and the department will tell you to apply. Then you apply and you come. That is how the way works. It's a state nominated. There is also family nominated, but pharmacist generally doesn't come under family nominated. You can check the updated info in the website. This is the example for Northern Territory for visa 190 and 491. In 2019, Northern Territory pharmacist expression of interest occurred with basic points 70. So even though you get 65 points, it's not that when I say 65 points here, it's not that you will be invited. These things will change. It's 70, maybe next year 75 or 65. It could be anything like. So this point system is more important. How the points are classified, it's no time to discuss here, but you will get all these updated details from the website. How each, like for example, age 5 points or qualification 20 points, whatever, I don't know. But those points will be calculated accordingly, which is given under the Department of Immigration website. Each state has got their own rules. So this one is Northern Territory. And if you look at Victoria, there is no 190 visa. It's only for those who study PhD with 5 years of application within. There is 491 visa, state sponsored, but only with the job offer. There is no government nomination. You need to have an employer in certain areas, rural areas, and if you get an employer give you a job and in an offer letter, then that can be used to apply for 491 and come to Victoria. So it's only certain states has got that's 491 state migration. Some of the state you need to have the job offer. Like these are the examples like New South Wales, again 190, 491 is available. This is a previous example in 2000 until 2019. Point base is 85. When you say 65, they invited only with those who got 85 and more. So it's better if you can work out in such a way that you can get at least 80, 85. Then you can comfortably apply. When the EOI is open, express your expression of interest, wait for the department to invite, and then apply comfortably. If you apply with 65, there's no guarantee that you might be invited with the basic. So you need to have at least 80, 85. Then it's more good to apply and come through this pathway. As I said, the point-based system, you can refer websites in depth how to achieve this. Again, there is a 190, 491 in Canberra is available, but with more conditions. So, yeah, so these are the basic things I would like to discuss. But anyway, it's not a straightforward or easy pathway, but not impossible. So it takes a lot of effort, patience, and research, and waiting to get these things done, which might take some time, but it is possible. It's not impossible. So anyway, at this stage, I might close this one and I'll show you some videos. And once after viewing some videos, we can have some discussion. Any questions you can ask me or you can email me. So once I finish this webinar, I'll go to the video and have you look at some few videos. So I'll just close this one and I'll show you some videos which is, yep. It may not be clear audio, but this is one of the dispensing machines. So yeah, this is one of the dispensing machine. We use it here. It's called ROVA. So in a busy pharmacy, where if one want to dispense some medication, the pharmacist get the prescription, he scan, and he look at the software, drug history. Then yeah, this is the machine that can be utilized for dispensing. And it integrated with all the software. And to load the tablets, you just put it inside and it will just put it in these certain slots. If you need 2 boxes, you can press 2, the machine will dispense 2. So yeah, in most of the busy pharmacies, these robots work in efficient ways so that the dispensing is happened more easily without much error. Yeah, so you can just take it and dispense. So I'll show you one more video of the ROVA machine. So this is how the ROVA operates. It's an internal video where you can see that how it works. It picks the machine, and also it will sort out. This is this stock transfer. Just putting the stock inside certain cabinets. Yes, so these are the ROVA, the new innovation machines. But I want to show you one last video. So you can see that this is a typical pharmacy where one stand behind the counter and dispense medication.
Many things actually are coming together all at once. Not only the health forces through child step, but the development of new health services, new private hospitals, how many specialists that are actually in town per capita. Orange is a happy place. Just have been been adding to that health hub by the different range of courses that they offer. The facilities at the time were
students with CSU, and it's all started in Orange, and I've had some graduates, and I've got two that are working with me as full-time pharmacists. The students from Charles Sturt, and they're developing graduates that are career ready.
It's a known fact that Charles Sturt has 100% employment record for their pharmacy course. So I knew that we were in good stead as the benefits in rural areas. We know in Charles Sturt that there are opportunities for pharmacists to actually come on board.
What I love about rural pharmacy is that it's a real community pharmacy. It's a family operation. Everyone that works here knows everybody that comes into the store, and it's often 3 and 4 generations. So regional pharmacists do get recognised for the great work that they do.
One of my proudest achievements is the fact that this year I've been named National Pharmacist of the Year for Discount Drugstores. I've worked in both metro and what's really important. I run a local community radio program, which I involve other healthcare providers. It's just hands down. You can't get it.
All right, so I think it's the time that we can stop the webinar. So again, I thank Dr. Sujit for inviting me for this webinar and giving you some brief introduction about how Australian system works and give some details about the little bit of information about the visa procedures and the registration and the basic info. Anyway, thank you all and best of luck.
Ibu, we'll have an interaction session. See any questions, you can post in the chat. We had an informative session and we got a very good information on the immigration policies and also the career opportunities for the pharmacist. Any questions, if you have, you can post it in the chat box or in the public chat box in the YouTube live. You can or directly ask to the resource person. There is a question from one of the delegate. They need to know whether PharmD from India can do master's pharmacy program in Australia.
Yeah, it's a simple, straightforward thing. So if you looking for masters for overseas, they can, but I don't think so. You need a PharmD. You can apply with BPharm. So they can study Master of Pharmacy. Anyway, check the websites, especially the University of Sydney, or there are a few universities like University of Tasmania. You can look at those universities, whether what is the entry requirements, and mostly it will be Bachelor of Pharmacy. And once you apply for the eligibility, they will do all this assessment. The university will do the assessment and will come back and check that you can apply. So it will be straightforward pathway, but I think the only main requirement is IELTS, or it's not big score like the pharmacists need to have 7, but I think it's 6.5 or something is okay. But just check it, please.
And one more question from, is there any PhD program in Australia where there's any scholarship exams available for the PhD program?
PhDs, there is there are few options, but it's all university based. You have to contact the university and coordinator. There will be a coordinator leader in the PhD program. So once you get a contact with them, they will be inviting you for more, like what's your interest and what's your previous, what you have done. And then you have to go from there. You can apply directly to the uni, but it's better you apply through the coordinator. But more details will be there in the website. So check Monash University, Monash Pharmacy University, and also University of Queensland.
Okay, there's one more question. How many years of experience is needed to work as a clinical pharmacist after completing a master's degree?
You don't need overseas experience. If you're referring to overseas experience, you don't need an overseas experience um, for working here as a pharmacist, but you need the experience to show for the visa purpose. So you need at least 1 or 2 years experience to show for the visa purpose. To get an experience, it's always Australian experience. When you say experience, it should be an Australian experience. Once you come here, but to work as a pharmacist, you don't need an experience because you're doing internship. So the internship is like an experience. Once they will train you all these basic things, then you pass the exam, then you work straight away as a pharmacist.
Okay, there's also one more question. And is there any opportunities for any teaching faculties? That is what one more question being asked.
Yeah, teaching faculties, the same thing. It's university related. So it's the main question is how do you come here? Like the immigration process will be hard, but you can check it. But there are opportunities. What people do, they come here to study, then they will transfer their career to the teaching opportunities. Job as a teacher will be hard, but not impossible. But these sectors are not very much explored. So you can look at these university website and go to career opportunities, and you can find, if it is listed under that, you can find the requirements. That's how you know what eligibility requirements to have. I'm not much into this sector.
Okay, thank you, Deepu. You can stop your screen share, I hope.
Okay, and that was
Priya, 1 minute, 1 minute. See, all the participants and delegates for their feedback form will be sent to their individual email, and from the email you will get your feedback form, and from there you will get your certificates. Okay, all your feedback forms will be sent to the registered participants email. Okay, okay, Riya, you can go for the vote of thanks.
Okay. That was the end of a very informative discussion. And now, on behalf of Hindustan College of Pharmacy, its entire fraternity and the organizing committee, I take this opportunity with immense pleasure to express my deep regards and gratitude to our eminent speaker, Mr. Deepu Prabhakar, who spared the time from his busy schedule to grace this webinar with his really extremely relevant address. Thank you, sir. Your insights regarding the scope, CAPS exam, visa process, everything will definitely help pharmacy aspirants who are looking forward to build a future in Australia. Thank you, sir. Thank you for joining with Hindustan College of Pharmacy. And now, my deep sense of appreciation and thanks to all the participants